In the complete hemodialysis series, today we are going to see regarding air embolism. Air embolism as such is a rare complication in dialysis, but is a detrimental one. Detrimental means yes, patient can go for cardiac arrest. So whenever there is a cause which is causing detrimental outcome, as a doctor working in the dialysis unit and as a dialysis technologist also, you should have a clear idea how to manage it, whether it is rare, very rare, whatever it may be. So in that, air embolism. What is this air embolism? Air embolism is nothing but air in a significant quantity is entering into the patient through the blood circuit, which leads to devastating complication. Nothing but an air bubble going and occluding the blood vessels, which leads to the complication. Causes. Where are all the problem can be which will lead to this air embolism? This pump, before that the blood is coming from the patient, that is called a pre-pump segment. That is a negative pressure area where blood is being sucked in. Whenever there is a disconnection there, that is called arterial circuit, the blood coming from the patient to the machine in the pre-pump area, it is pulling the blood. So whenever there is a disconnection, either the fistula needle or the catheter, if there is a disconnection, air will suddenly enter in. That is the most common site where the air will enter. But if you see, there is a air detector here, which will detect whenever there is air and it will shut down the pump. This is the final pathway before entering the patient after the dialyzer. So when the air detector is functioning normally, usually air embolism won't happen. Malfunctioning of the air bubble detector, if it is there, yes, air might enter. Third one is inside the dialyzer, in the fresh dialyzer or in the reused, more common in the fresh. If the priming process is not good, some kind of air will be inside. Once the dialysis started, air might enter the patient if air detector is not connected inside the dialyzer because of the improper priming or improper liquid inside the dialyzer. The air might enter. Fourth, any kind of disconnection which can happen. Arterial circuit is there, patient is sitting, all of a sudden disconnected. Fistula is there, the connection is intact, but there is disconnection between the tubing and the fistula tube. Air might enter. So these are the situations which described theoretically where air embolism is common. But one point I have to mention is this drip chamber. There are two drip chamber, here and here. From the patient to the dialyzer, there is a drip chamber. Here I hope you are able to see this, a small can-like structure, and this side there is a drip chamber from the dialyzer to the patient. So wherever the air enters in the circuit, which will get collected here, you can see there is a gap. And there is a gap. You can see there is a gap. So blood will be connected. The air will be above. The blood will enter the circuit, main circuit. The bubbles won't enter the main circuit because there are two drip chambers. But whenever this chamber is full, there is no space for the air to get collected. It might enter the circulation. That is why this chamber should not be full. And this is usually common with the newbies. The newbie staff who is entering, you have to tell them clearly the importance of this drip chamber. It have to be half empty so that air will be collected. So these are all the causes because of which a patient can get the air inside the body. Most commonly it is dislodgement. Practically what will happen? Dislodgement. In the circuit, if it happens, usually air detector will detect it. For the theoretical description, pre-pump segment, any kind of dislodgement. Inside the dialyzer, post-pump, any kind of dislodgement from the catheter or this detector malfunction, drip chamber is full. This you have to take into consideration. So this is all about the causes, how the patient can develop the symptoms, which is called the clinical feature. Can be mild to cardiopulmonary arrest. It can start with the pain, sudden onset hypotension, chest pain, seizure, if it is mild, nausea and vomiting. But you should be act promptly to suspect this patient might have detected this. The prequel to the symptoms will make you understand it could be air embolism. Whenever there is a dislodgement, whenever this is not connected, air bubble detector is not connected, if the patient is developing sudden symptoms, hypotension, tachycardia, chest pain, seizure, altered sensorium, or any sudden unexplained symptoms, always think of air embolism. So how to treat it? You have come to know there is some dislodgement, suddenly the patient deteriorated. You have to put the patient into Trendelenburg position. I hope as a medico who are seeing this, you know what is Trendelenburg position. No need for further explanation in that. In simple terms, put the patient in the left lateral side and put the head at the lower level, so that air won't enter the major organ like brain, heart and lungs. It won't enter, because if the patient is sitting, the air obviously from the venous side enter into the heart or pulmonary circulation or sometimes into the brain. It might have devastating complication if it enters the major organ. So treatment, put the patient into the Trendelenburg position and give cardiopulmonary support. Hyperbaric oxygen might be required, or in the dialysis unit oxygen is there, give a high flow oxygen, and usually it will resolve. The air won't be that much big practically to cause cardiopulmonary arrest, because that is why I told it is a bit rare. If you act promptly, you can prevent the detrimental complication. Is there any other treatment? Yes, hyperbaric oxygen therapy is there, but high flow oxygen, Trendelenburg position, usually it will resolve. And as I always say, prevention is better than cure. Make sure the patient is not developing air embolism. Make sure the connections are good, it won't go for dislodgement, and inform the dialysis technologist or the person who is handling the duty doctors, whoever it is, there's a complication like this. You have to be aware of, make sure this bubble detector is connected. Prevention is better than cure. Is there any theoretical treatment which is required? Theoretically, most likely patient responds to hyperbaric oxygen and Trendelenburg position. There are option of tapping out the air bubble if it is in the heart, but usually it might not be required, it usually resolved. So what we have seen, what is air embolism, what are the causes, clinical feature, how to prevent it. So that is for this episode. In the next episode, another topic. Bye bye.